A typical day for us is actually long, and it depends a lot on whether it's a day in which we're in the operating room or a day in which we're in the clinic. But it usually starts actually early with academic lectures, which are generally at about 6:30. So most of us are in even before that, so about 6 a.m. And then you either go to the operating room, which starts at 7:30, or you go over to the office area and see patients. And it's fairly typical that those things will run until 6 or 7 o'clock at night. We don't turn people away. So if you need to be seen, we'll figure out how to see you. And we have a structure set up for regular office visits for people who come, but also for people to come in with urgent problems. Our door, in a sense, is almost always open for people to come in, and we try and triage or prioritize the importance of their visit, how fast they need to come in and get them seen.
So in case you have anything.
In addition to the orthopedic surgeons, there's a whole host of other providers that really contribute to the patient experience and also to the quality of care. So we have wonderful nurses here, wonderful nurse practitioners, a great number of physician's assistants. Being a teaching hospital, we have the luxury and privilege and also the advantage, I think, of having fellows and residents, so people are still a part of their, still receiving some of their surgical education, but indeed provide round-the-clock, really comprehensive, wonderful clinical care. How that translates into an outpatient visit, I think, would be that when people bring their children in to be evaluated, be it for a broken arm or a sore knee or a sports-related shoulder injury, they can expect to see a whole host of people, all of whom are adding a different puzzle piece to the big picture, providing different components of care.
I might call them when they go home from surgery and say, "Hi, it's Jessica. We met at your preoperative eval." Then they come back 2 weeks later and they see me again. And then when they sort of go through their postoperative course and they see Dr. Waters, I'm always that familiar face who, I've met them from even before they started surgery. I'm their contact person who they call, and you establish a relationship. There's no question to me that for families that makes their entire experience here run more smoothly and gives them comfort. So
Just needs to be kind of kept clean and dry, Mom, so it doesn't get into any troubles with infection.
They would come in, have a comprehensive history taken, a comprehensive physical examination, X-rays or MRIs or other ancillary studies might be obtained. And then we would, sit down with the family and the patient, go through what our impression is, what the treatment options are.
Port 4?
So depending on the complexity of their problem, they actually may have 4 visits in one, so to speak. So we try and help people understand that in advance. And while they're here, we try and help them understand that each one of those visits may have some time delays or some complexity associated with it. So our concierge tries to help people literally move from one quote-unquote visit to the other during their time here. So some are very simple. You come in and you see the doctor or the nurse practitioner, physician's assistant, and you go home. And some are more complex where you have to go from place to place to place and see all these people.
We escort patients to areas in the building that they might not be familiar with. We'll have a seat with them. We have various references here that kind of refer to the studies that they might be having that day. We also give them a guide with all the machines that they might come across. And we also service pretty much any other general concierge need, whether it be, directions to somewhere to eat, somewhere else in the department, you need a cab, you need somewhere to stay, things of that nature. So pretty much anything under the spectrum of helping, we're here for.
We literally anticipate that on a daily basis people are going to need our help. So we staff a phone room with nurses and nurse practitioners and administrative assistants whose job it is to answer calls of people in need. And it's very common that we'll field 200 to 500 calls a day. And then the clinic area is just always busy because of that and because of our doors always open policy. The good news for people is that when they come in for their appointment and they're seen, they don't go home until we've resolved their problem. Right?
And you can see she's busy.
What's unique about us is that we see everything from really relatively simple orthopedic problems all the way through to the most complex that only a place like Children's would see. And so when you come into our clinic, the spectrum is there literally every day. Reason why I think most of us chose pediatrics is just simple caring, that, we care for the children, we understand the importance of our future, and they are our future, and we understand, in a sense, how much they're in need. The place has a special feel because of that, because that commitment kind of is in everybody who walks in the door, that I think then goes out to the patients, that they feel that as well. They benefit from that quality of care, and they benefit from that longevity of what we have together.